Hyzaar tablets is used to treat high blood pressure. It is also used to lower the risk of strokes in patients with high blood pressure and enlarged heart. Lowering blood pressure helps prevent strokes, heart attacks, and kidney problems. This product contains two medications, losartan and hydrochlorothiazide. Losartan is an angiotensin receptor blocker and works by relaxing blood vessels so that blood can flow more easily. Hydrochlorothiazide is a water pill diuretic that causes you to make more urine, which helps your body get rid of extra salt in water. Indications. Hyzaar is indicated for the treatment of hypertension for patients in whom combination therapy is appropriate. Hyzaar is indicated to reduce the risk of stroke in patients with hypertension and left ventricular hypertrophy. How to use. Hypertension. The usual starting dose of Hyzaar is 50 12.5, losartan 50 mg, hydrochlorothiazide 12.5 mg once daily. The dosage can be increased after 3 weeks of therapy to a maximum of 125, losartan 100 mg, hydrochlorothiazide 25 mg once daily as needed to control blood pressure. Initiate a patient whose blood pressure is not adequately controlled with losartan 50 mg monotherapy with Hyzaar 50 12.5 mg once daily. If blood pressure remains uncontrolled after about 3 weeks of therapy, the dosage may be increased to 2 tablets of Hyzaar 50 12.5 mg once daily, or 1 tablet of Hyzaar 125 mg once daily. Initiate a patient whose blood pressure is not adequately controlled with losartan 100 mg monotherapy with Hyzaar 100 12.5 mg, losartan 100 mg, hydrochlorothiazide 12.5 mg once daily. If blood pressure remains uncontrolled after about 3 weeks of therapy, increase the dose to 2 tablets of Hyzaar 50 12.5 once daily, or 1 tablet of Hyzaar 125 mg once daily. Initiate a patient whose blood pressure is inadequately controlled with hydrochlorothiazide 25 mg once daily, or is controlled but who experiences hypokalemia with this regimen on Hyzaar 50 12.5 once daily. Reduction the dose of hydrochlorothiazide without reduction the overall expected antihypertensive response. Evaluate the clinical response to Hyzaar 50 12.5, and if blood pressure remains uncontrolled after about 3 weeks of therapy, increase the dose to 2 tablets of Hyzaar 50 12.5 once daily, or 1 tablet of Hyzaar 125 mg once daily. Hypertensive patients with left ventricular hypertrophy. In patients whose blood pressure is not adequately controlled on 50 mg losartan potassium, initiate treatment with Hyzaar 50 12.5. If additional blood pressure reduction is needed, increase the dose to Hyzaar 100 12.5, followed by Hyzaar 125 for future blood pressure reduction at other antihypertensives. Contraindications. Hyzaar is contraindicated in patients who are hypersensitive to any component of this product, in patients with anuria, for co-administration with aliskiren in patients with diabetes. Warnings. Don't use Hyzaar if you are pregnant. Stop using this medicine and tell a doctor right away if you become pregnant. You should not use this medicine if you are unable to urinate. If you have diabetes, don't use Hyzaar together with any medication that contains aliskiren, a blood pressure medicine. You may also need to avoid taking Hyzaar with aliskiren if you have kidney disease. Drinking alcohol can future lower your blood pressure and may cause side effects. Avoid becoming overheated or dehydrated during exercise, in hot weather, or by not drinking enough fluids. In rare cases, Hyzaar can cause a condition that results in the breakdown of skeletal muscle tissue, leading to kidney failure. Call doctor right away if you have unexplained muscle pain, tenderness, or weakness, especially if you also have fever, unusual tiredness, and dark colored urine. Hyzaar side effects. Get emergency medical help if you have signs of an allergic reaction to Hyzaar, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Call doctor at once if you have a lightheaded feeling, like you might pass out, irregular heartbeats, eye pain, vision problems, kidney problems, little or no urination, rapid weight gain, swelling in your hands, feet, or ankles. Neuroworsening symptoms of lupus, joint pain, and a skin rash on your cheeks or arms that worsens in sunlight. Or signs of an electrolyte imbalance, increased thirst or urination, confusion, vomiting, constipation, muscle pain, leg cramps, irregular heartbeats, numbness or tingling, severe weakness, loss of movement, feeling jittery or unsteady. Common Hyzaar side effects may include dizziness, back pain, or cold symptoms such as stuffy nose, sneezing, sore throat.